Police reform and the coronavirus pandemic, two big issues that San Diego County is facing right now. And joining us live to talk about both is County Supervisor Nathan Fletcher. Supervisor, thank you for joining us. Thank you for your patience through that a moment ago. I want to start with the protests over the death of George Floyd and calls for reform to policing here in San Diego County. Last week, all of the county's major law enforcement agencies banned the carotid restraint, for example. Is that enough? What are people saying as far as that, and what would they and you like to see done beyond that?
No, I think it's a good first step, but it's just a step. It's simply banning one technique that was used, but I think that there's a lot more that we need to do. I think a proper realignment of what is the proper utilization of law enforcement. I've long talked about that it doesn't make any sense that law enforcement responds to every mental health issue, every person who is using drugs, every homeless individual. I think those are things that could be better served, and long thought those could be better served in other ways. I think we have some work to do to ensure there's proper oversight of law enforcement in an independent fashion, in an independent way. And there's certainly a lot of training and other types of things that need to happen, not only in law enforcement, but for all county employees and frankly for all society. And I think that what we're seeing is a reckoning of hundreds of years of systemic racism that isn't going to change overnight, and there's not one policy that's going to change, but we have to show a sustained and meaningful commitment to actually enact real change.
Take me behind the scenes a little bit, if you will, Supervisor. You have people who want to see change in this country, people who've been protesting now for upwards of 2 weeks. How does it go from their voice to people like your ears, right? Leaders in our county, leaders in our state, leaders in our country. Show us a little bit of behind the scenes, I guess, as far as how those messages lead to change.
Well, their voice, a perfect example of this, Andrew, is it was over a year ago that I approached the sheriff about trying to get rid of the carotid restraint. We had data, we had evidence, we had all the facts behind it. It didn't make any sense then. And we got considerable pushback, and they just said, no, we're not going to change it. And then in light of what's happening, people were willing to take a fresh look at a lot of policy proposals. And so many of the things that are being called for aren't being called for because George Floyd died. They've been called for years. They've been proposed and they've been suggested for years. What we're seeing now is a greater ability to get the votes you need to actually enact the changes that have been called for some time. And so I commend the folks, the activists who are out there that have been pushing these issues. We've been in alignment, we've agreed. Now what we're seeing is a greater political willingness to embrace some of these difficult topics. And that's the moment that has to be seized to drive real change.